grit. Andrew completed his MD, followed by a PhD in biomedical engineering at the University of Alberta. His research interest is in development of medical devices and systems with an interdisciplinary approach. We're very excited to have Dr. Chan as our Smart Talk speaker today, but there are just a few housekeeping notes before we start. This session is recorded. I will encourage everyone to participate in the Q&A period after the talk. You can ask your question verbally at the end of the talk, or you can write your questions in the chat and I'll ask them on your behalf at the end. To preserve bandwidth, you may want to turn off your video during the talk. And with that, I turn it over to you, Andrew.
Thanks, Mike, for the great introduction. And yeah, so we're very excited. We're a pretty new group. We just started our lab last year, part of the PATH program. So PATH stands for the Program to Accelerate Technologies for Home Care. And our goal really is to bring remote monitoring, especially remote health monitoring, into the mainstream. So to give you a bit of an outline of what I'm going to talk about, I'll give a very brief overview of what the PATH program is. I'll discuss a bit of the background of what aging in place involves, some of the research and the scoping review we did on remote monitoring, and then talk a bit about how smart home technology and home health technologies interact and some of the clinical applications that we're considering in starting up with our lab. So the PATH program is a partnership between 4 different academic centers, University of Toronto, Waterloo, Alberta, and Ottawa, alongside Smart One Solutions, which is a housing development company, to combine multiple communication protocols against various sensors, actuators, and devices onto one interface. If you'd like to see our website, there you go. You can go to our website down there. But essentially, we're all trying to come together to make one platform so that we can do smart home and remote monitoring research together. And so the PATH Edmonton team is composed, as Mike mentioned, with Jeff Gregson, Adriana Rios-Rincon, Mike, and then we have a few students, myself as a postdoc, and then Stephen, Lina, and Jaden are all students that have just joined the team to help us develop some of these capabilities. And so we're mostly based out of GRIT, so the Glenrose Rehab Research Group out of the Glenrose, but obviously we have a lot of connections with the university as well. So in terms of aging is a growing challenge that our society is facing, especially in Canada. There are 6 million Canadians that were older than 65 in 2014, so that's already 8 years ago. Within 10 years, it's going to be almost at a quarter of our population. So 9 million people are going to be over 65. Our life expectancy is rising. So it's rising from 86 to 83 for men. But even though the life expectancy is rising, it's not that people are more debilitated or that they're unable to do things. In fact, the opposite is happening. The majority of seniors want to remain active. They want to participate in social activities. 36% of seniors continue to volunteer. 13% participate in the workforce. And these are all stats from the Government of Canada. And so one of the big goals of the Government of Canada is really to set out to promote healthy aging, to allow people to age and have a great quality of life. And a big part of this is this concept of aging in place. Now, aging in place is the idea of each person having their health and their social supports and services that they need to age safely and independently in their own home. So rather than being transferred to a community care center, they can age in their own home as long as they wish and as long as they are able. And there's a lot of different benefits as to why this might be a concept that we want to adopt in Canada. First of all is the idea of independence. There's a lot more improved satisfaction and a sense of identity when people have control and autonomy over their own lives. And a big part of that is control and autonomy over their own home. Number 2 is comfort, and often we might underestimate this, but the emotional value and the familiarity and security of living in your own home is actually very significant. There's a lot of studies showing that have shown that people who live with dementia, oftentimes when they get transferred, that's when the decline actually starts to increase, whether it's because they become more confused and they're not quite as familiar with the surroundings. So keeping people at home as long as possible is really a huge benefit. Number three is health. And we've all lived through COVID, and we know all the stories about outbreaks in long-term care centers. In the first wave alone, 1 in 3 long-term care centers had an outbreak. So that's a huge number of people who are locked down, who can't see their family, who can't enjoy much quality of life because they are living in an institution where infectious disease can spread really quickly. And so for health reasons, aging in place can be potentially something that's very powerful. And lastly is cost. Reduce costs for the individual and also for the government. So the capital cost of a new long-term care bed alone is around $320,000. And they've estimated that they need to build around 200,000 of these beds across Canada up to 2035. So that's 65 billion right there. And then the operating costs, so $75,000 per year. That's a huge amount, right? And so adding that all up, that goes up to 130 billion. So that's around 200 billion in long-term care beds across Canada up to 2035. So just to give you a bit of context, before COVID, the annual budget of the Canadian government was 300 billion. So we're talking about 2/3. So if we're able to shift some of those costs, reduce the cost of building these new places and find new ways to allow people to age in place, we can potentially save both individuals if they need to pay for some of these long-term care services, and also the government and taxpayers a lot of money if we can do that. So what are the things that we need to consider when we're developing something for aging in place? Number one is the home itself. So how do we adapt the home to meet my needs? How do I stay safe in my home and my community? Number two is the whole neighborhood and transport. So how do I access services? How do I go out? Do I take the bus? Do I ride my bike? Can I walk to services and amenities? Community. And so what I mean by community here is really the sense of community and connection with other people. So how do we receive supports and receive services in the home, whether it's home care or other services? How do we connect with friends and family? And then lastly is the idea of health. So how do we manage these health conditions that slowly start to creep up? How do we maintain a good diet and active lifestyle when we're living at home? And so our initial question is, can we use technology to help with aging in place? And we think we definitely can, with whether it's house adaptations, safety, connectivity, and health. To give you a few definitions, because when we were first doing a literature review, it was very confusing in this space. Honestly, it's still confusing to me to some degree. Not all the terms are very consistent, but the term Ehealth typically just refers to any kind of electronic health service, but it tends to mean more so something to do with electronic health records or electronic health systems. So Connect Care would be more considered on the eHealth side, and so it's more clinic driven. In the middle, we have more of the telehealth, so caring for people at a distance. So telemedicine, which is really big at the U of A, so doing remote diagnostics and treatment via video conferencing. So that includes telerehab and all these technologies that can do that. And then telemonitoring, so that's kind of our space, trying to figure out if we can get objective data from people who are at home. So that could be physiologic data, that could be activity data. Remote patient monitoring and home health monitoring are very similar to telemonitoring. And then more on the user side would be mHealth, so different apps or navigation methods that allow users to manage their own health. So we're very much playing kind of in the space where we're kind of in the middle between clinic-driven and user-driven. And so we have to navigate how are we going to do this and how are we going to move forward in enhancing people's health through telemonitoring. But before we develop anything, we need to look at the clinical question. Is there any evidence that health monitoring can actually help with aging in place, especially with managing patients' health? And so myself and a bunch of the HQPs from the other sites, we came together and put together a scoping review of systematic reviews on remote monitoring technologies. Now, we didn't do a full scoping review of all articles because there's thousands upon thousands of articles in this field. We really want to focus on the evidence, so the clinical evidence for remote monitoring. And we found 4 different major themes across these systematic reviews. Number one is acute health detection. So that's things like detecting an exacerbation of heart failure or COPD, or detecting a fall. Number two is chronic health management. So can we manage high blood pressure, diabetes, high cholesterol, chronic kidney disease. So things that are kind of rumbling along. The patient doesn't really notice any symptoms from these things, but we do need to manage these so that they don't become symptomatic or become something worse. Number 3 is monitoring degenerative neurologic diseases. So these are things like Parkinson's or Alzheimer's or dementia itself or MS. And that number 4 was encouraging physical activity and supporting rehabilitation. Can we use this monitoring technology to allow people to, enhance adherence to rehab programs or get them to exercise more? We also compiled a lot of articles in these systematic reviews that are on human factors. So how usable are devices? How acceptable are they? And then the ethical questions that we have. And so I'll go over those a little bit later on as well. So first of all, the evidence in these 4 categories. Overall, we definitely found that there's good evidence that health monitoring can help patients. Specifically for acute event detection, we found that monitoring exacerbations of heart failure and chronic obstructive pulmonary disorder, or COPD. If you monitor patients who are at high risk of exacerbations, you can reduce healthcare usage. That's emergency department visits, that's hospitalizations. In some studies, they found that you can reduce mortality as well. So definitely there's some healthcare benefits there. Chronic disease management, if you monitor any of these things like blood pressure, cholesterol, blood glucose, specifically blood pressure and blood glucose, there are definitely benefits in reducing blood pressure and reducing blood glucose when they are regularly monitored, and not just monitored, but communicated to somebody else, communicated to a clinician so that they can have a care team help manage the patient as well. For degenerative diseases, this is where the studies were the weakest and it's the hardest to do, right? You have people who are struggling with dementia for many, many years. And so putting together strong evidence over these really long-term studies is really challenging. But they definitely did find that over the long term, you are able to detect some cognitive decline, though there are some mixed results in trying to reduce some unsafe events at night when they need to go to the washroom or something like that. And then lastly, with active lifestyles, definitely across the board, there's higher adherence to exercise programs. And when you get people to exercise and people have these other comorbidities, it definitely improves their quality of life. And so we have found that there's definitely benefit. It's not completely clear in terms of how strong the evidence is, but there is definitely some sort of benefit with reducing healthcare utilization, improving health metrics like blood pressure and blood glucose and cholesterol, and then increasing physical activity. However, there are still a lot of challenges. As I mentioned, the evidence is not necessarily strong because the nature of home health monitoring, it's just you have all of these other confounding factors that might be involved. And large scale studies are really hard to do on a complex process like aging. I mean, what is the outcome? Is it just immortality? Is it just healthcare usage? Or are there all these other potential benefits that aren't being measured in these more objective studies? So the second thing we looked at was the human factors, and we found, again, 5 themes that people were concerned about in terms of whether or not they're willing to adopt home health monitoring technology. So number 1, privacy, privacy, privacy. It's not just informational privacy in that you're worried about people stealing your data, but it's just a sense of always being watched, having cameras or these different sensors always tracking what you're doing. There's a lot of reluctance to go with those kinds of technologies, and there really has to be a huge benefit in order for people to accept those. The fear of you losing control. People desire to make decisions about how their life is working. So if you put on a device or we put a device in the house, can we turn it off? Are we placing it in a place where it's not so invasive? And when are we collecting the data? Is there certain data that we would rather keep to ourselves rather than share it? So that idea of controlling, having control over this monitoring technology is actually very important. Social interaction. So there's always a fear that if all the communication is happening virtually, that older adults will lose that in-person interaction with their family members or with their loved ones. And if the technology fails, then what do? Can you actually have any communication with other people? That's a huge challenge that they face. Stereotypes and stigma. We spoke with a company yesterday that when they first launched one of their platforms, people thought, oh, this is a great platform for everybody else, but I don't really need it. And there's this sense that if I'm using a health platform like this, then that must mean I'm sick. And other people might judge me for that. And so they had to shift their strategy that rather than making it into just a burden, like some sort of health platform that shows that they are in some way different from everybody else, they had to shift their strategy in what this technology can do for them. And then lastly, idea of autonomy. Fear of being a burden or dependent on others. If the technology fails, I have to ask my son to come over and fix it. I'm always have to be connected with these technologies. So these are the human factors that are really important to users in terms of whether or not they're willing to adopt these technologies. And so we found definitely home health monitoring is very unique amongst the healthcare field because the user is the center, and it's forced to be the center because they have control over the device, whether they turn it on or whether they wear it. So it has to be non-paternalistic. The data acquired, it tends to be uniquely valuable to the user rather than the clinician or technician. You're tracking someone over a long period of time. And so, for example, for physical activity, the user might be interested, hey, am I doing more physical activity, or are there things that are preventing me from doing it? Clinicians and technicians, they may not have the time to look at every single patient and track everything. So the user really has to be the center when it comes to home health monitoring. And so we definitely are taking the approach of co-design with the user on device usage and how data is collected. So at the very least, we can see that there is evidence that home health monitoring technologies can improve outcomes. We know that home health monitoring requires really close consideration of the user's needs and desires. And we know that there's tons of different technologies. There's wearables and health devices, smart infrastructure, smart tech, all these I'll talk about briefly later. But there's tons of different technologies that we can use. And so can we actually integrate these data sources into a single smart home system that is, user focused and user controlled rather than making it all too clinical? And so the term smart home is pretty much just a house that has sensors and actuators. So they can sense what's happening in the home, and so they can monitor the context and then do something about it, right? Improve their experience. They can do something in response to these monitoring, whatever they have monitored. So there's home automations, this idea of enhancing their quality of life by controlling devices and systems at home, or just notifying somebody that something needs to happen. And then monitoring wellness. These sensors, they have to have the aim of maintaining the well-being and bring some sort of quality of life to the patient, as opposed to just monitoring for the sake of monitoring. So I'll go through some of the devices that we're exploring right now and some of the things that can be possible with these devices. So number one is wearables, very, very common. Detecting your heart rate, they can detect respiratory rate, accelerometers can detect your activity. We are working with this POSIX UWB localizer, which is able to localize these little tags within 20 to 30 centimeters within a home. So potentially very powerful technology to allow people to monitor and track what they're doing in the home. And they all have their different apps and different ways of connection. So can we connect to these different APIs and SDKs and collect all this data and put it into a centralized framework so we can analyze the data a little bit better? The health monitoring devices, so these are more standalone, like weight scales that are connected by Bluetooth. The Willing Sleep is able to detect heart rate and respiratory rate, and also the sleep quality. And it also has a microphone to detect sleep apnea, which is really powerful. Blood pressure cuffs and oximeters, all of these, we have these devices, but can we actually connect them to a cloud interface or connect them to a central server so that we can put the data together and actually make sense of it, as opposed to having the user, take their blood pressure, then write down the blood pressure and then email it to a person. And again, all these different devices have their little apps that they can work with. We have smart infrastructure. And so we're working with Smart One Solutions who put together these devices that are shown on the screen. So access systems like digital locks and video doorbells. One of the feedback we've gotten from clinicians is that when they are discharging someone with dementia at home, the door security is a really important thing. So can we take that image that's coming from the video doorbell of whoever's at the door and stream it to or send it to a loved one so that the person can actually confirm, this is someone that I can trust, or is this someone who's trying to sell me services and they're going to try to make me sign a huge contract of some sort, right? So can we have that kind of connectivity to allow us to feel relieved, allow caregivers to feel relieved that their loved one will be safe at home? We have security systems, which are pretty standard: motion sensors and door contact sensors throughout the house, which can detect what's happening in the house. And then emergency sensors like smoke detectors and water leak sensors. And then lastly, I like to call these the Boxing Day devices, smart home devices that are really, really cool, right? The Amazon Echo Dock that can talk to you, and you can talk to it and can do things.
Good afternoon. How are you?
We have the Ecobee thermostat, Philips smart lights, and the Nest Hub as well. These are all different smart devices that we can use to, that people can use to really interact and have good quality of life.
So Andrew, could you ask people to turn off their microphones if they're not talking?
Can I
I'm not able to mute everybody.
Bonnie Dobbs, could you please turn off your mic?
No, it's I bought it way back when.
Sorry, I'm trying to get her on the list so I can turn off her mic, but
yeah, no problem. Yeah, I'm not able to mute other participants.
There we go.
I never did use it at Patel.
Oh, great. Thank you, Vivian.
Sure.
Yeah, no worries. All right, so yeah, so these are the Boxing Day devices. We just bought a smart lock ourselves just to try it out and see if we can improve our quality of life, and it definitely does. Carrying 2 kids with groceries, if the door can just open for you as soon as you get near, that's a really big help. And so can we kind of integrate some of these technologies as well to improve people's quality of life? And so we have, tons of sensors out there in all these different ecosystems, and they work in all different ways. We have activity and physiological sensors, localization, home security and safety, all this stuff. And then we need to connect them somehow to actuators, right? Visual dashboards that tell you things, or audio reminders that, oh, you should probably take your medications now that you're close to your medication box. External notifications, oh, your loved one may have fallen, or something might have happened to them, you better check in on them. And in-home automation, so patients with dementia, if they need to go to the washroom late at night, can we have lights that turn on the bottom of the floor as they're walking through the house? And there's definitely technologies, especially in Calgary, that they're developing to do that. And so we want to be a part of that. How can sensors be connected to actuators that improve wellness? And again, going back to the aging in place goals, how can we help people stay safe, manage their health, and manage a good diet and lifestyle? And then in terms of their social connections, access services, and connect with supports. And so as a new lab, trying to brainstorm and figure out what direction we want to go, we have kind of 4 focal points that we're focusing on now. But we expect that there's going to be more and more different applications and low-hanging fruit that this kind of technology might be very useful. And the first thing we're working on is a usability and acceptability study of these remote monitoring technologies. So with wearables and with home security and infrastructure, what kinds of devices are people using? What are the fears and barriers to using devices? And what are the factors that affect acceptability of these devices? Number 2 is discharge planning. I remember as a medical student, when we discharge people off of internal medicine, it would be, we write down our orders on a sheet of paper, we write down what happened, and then we write down the name of their family doctor. We'd go talk to them, give them the sheet of paper, and tell them a little bit of what they should expect. And then that was it. So there's a lot of, it'd be nice if we could smooth that transition a bit, where they're not just going off out into the world and not necessarily having the supports they need. So can we smooth the transition between discharge from hospital or rehabilitation to managing at home? Number 3 is we're building the expertise and skills to develop remote monitoring tools to understand the clinical, the usability, and the technical challenges that are related with remote monitoring. And then we really want to showcase, these technologies are the future, integrating these into a single system that is controlled by the user, but connected to clinicians and loved ones. This is where smart homes are really going to have their power in improving people's wellness. And so in terms of our acceptability study, we're doing it. We just got ethics approval to interview and do focus groups with different older adults and caregivers to see, what are the factors, what are the things that are, or what are the kinds of things that will prevent you from adopting these, whether it's, oh, it's too much effort, or there's not enough benefit from these things, or my friends aren't using it, or it's not fun to use, right? There's a lot of different factors that will move in, and we want to research those. Number 2, Regarding discharge planning, we're working a little bit with stroke rehab to figure out if we can help out with early support discharge. So early support discharge, a really powerful program where motivated participants are discharged at home and they have intensive at-home rehabilitation to try to maximize outcomes while understanding that they don't necessarily need to be in the hospital. And so tracking their safety and tracking their rehab progress is really important. And so can we provide devices that can get objective measures on their rehab progress and improve their patient safety? So things like, can we track their activity and the usage of their limbs, whether or not one is weaker or stronger than the other? Can we detect falls? Can we detect sleep apnea? Can we track their blood pressure if they have any kind of dysregulation of their nervous system? So can we provide devices that can help check these things at home? In terms of rehab monitoring tools, we've been consulting with cardiac rehab. So a lot of their in-person rehabilitation, obviously with COVID, has gone virtual. And so it's hard to know exactly how much exercise or what kinds of exercises they're doing at home. A lot of it depends on patient reporting, which might not be comprehensive to what they're actually doing. And so can we give them some devices to quantify and the quality of their cardiac rehab, again, with these wearables and home health devices? And then an adjunct to this as well is that when they're discharged, often they'll be taking medications like beta blockers that might reduce their heart rates. So can we tell if they're taking these medications? And if they are taking the medications, can we tell over the long term, is it actually having an effect on their heart rate and improving their heart health? And then lastly, this is kind of what started the PATH project in Edmonton. And it's this idea of safety in the home for people with dementia. And a lot of our consultations with the clinicians, the idea of having people go home, it's really a huge burden on caregivers to take care of their loved one at home. And so we wanted to build some sort of platform that can give a bit of peace of mind and install home monitoring technologies that can monitor patient activities, that can notify people of emergency events. We wanted to use the localizer to track, where is the patient moving around the home, and is there a change in their movement patterns that we might be able to detect that helps us to detect whether or not they have some sort of cognitive decline happening that's happening a little bit more rapidly, or are they forgetting things and they're not telling us as well. And then audio reminders and external notifications. So can we remind people to take their medications or remind them to do certain things or the steps to cook their favorite meal or something like that. And so there's lots of adjuncts to mapping out what people are doing in the home, whether that's tracking physical deficits or mobility mapping and assessments of, how do they move in the home and how can we make that a little bit more efficient using these devices. So overall, lots of things that lots of ideas that we're working with right now. In the near term, we're working on a few pilot studies on remote monitoring, putting together small apps that can draw data from these different devices and then build that clinical comfort with monitoring and also user comfort with monitoring. In the medium term, we're developing and we're also exploring other people who have already developed platforms that allow flexibility to add commercially available devices from all these different companies. Again, we really want to have a patient-focused approach on data control, and we want to build out that infrastructure that might allow for better security and faster feedback in terms of what's happening with the data. And then over the long term, with all of PATH Canada, we are looking into data analytics. So with larger data sets and with more patients and more people, we can actually do some deeper analytics and finding long-term trends in how home monitoring might be able to help. And so we certainly would want to partner with different organizations to train and run machine learning and AI algorithms as well. And so how we can connect with the overall PATH Canada, PATH Canada has already developed really a platform for testing smart home and health monitoring devices across Canada. And we're still building on the capabilities of that platform that's being built out of Toronto. And then we've partnered with Smart One as well because they are building out smart condos. And so they are building out that infrastructure of having servers in their buildings so that all of these devices can connect locally. You can do the processing you need locally in that infrastructure and then send out any notifications or the important information out from there. And we also hoped that when we have all of this infrastructure, we have all these resources with Smart One, we can help researchers who are testing new devices to commercialize and test their devices in real life that are connected to central locations so that they can collect data without constantly reinventing the wheel of working through different APIs and trying to develop these networking capabilities for these products. And so this is kind of how we connect with Path Canada as well. And so to conclude, I kind of have 4 take-home messages for you if you haven't remembered anything at all. I always tell that to my students anyway. So first of all, aging in place is certainly desirable in a lot of different ways, and it's becoming more and more realistic for many older adults that are using technology. Remote monitoring is supported in the literature. There's definitely evidence that it's efficacious in preventing acute disease exacerbations, monitoring chronic diseases, and helping with rehabilitation and physical activity. But there's a shift that needs to happen from merely sensing health and giving them to clinicians to work with, to having residents manage their wellness as well. And so we need to build that kind of infrastructure that allows users to manage their wellness alongside clinicians. And so the Path platform really exists to facilitate these interdisciplinary connections. You can see that our whole team is quite interdisciplinary between engineers and occupational therapists and business-focused people. So facilitate these connections and develop and investigate different infrastructure models to figure out how we can connect these devices, and then also support remote monitoring research that's growing by the day in Alberta. And so with that, I'd like to thank our funders, so AgeWell and MyTax, as well as the Glenrose Rehab Research Innovation and Technology Group, and then the co-investigators, Jeff, Mike, and Adriana, and the different HQPs that have been a huge help in developing all this technology with me. So thank you very much, and I'll open the floor to any questions.
Thank you, Andrew. So the floor is open. You can either just shout out your question or put it in the chat and I'll read it at the end. Please go ahead, anyone. Oh, I've got one in the chat, so I'll read it out. So how can we prevent misuse of data by for-profit interests, e.g. selling data to insurance companies?
Yeah.
So Andrew, amongst your many degrees, you don't have a law degree yet. But, can you tackle that one?
Yeah, I mean, that's a big, that's a major reason why we're like Toronto is building out a more open platform to use amongst academics. And it's because we're not entirely sure what other platforms would use the data for. Whereas by building a research-focused platform, we can have more control over what's happening with the data, and we have to go through ethics for all of our studies so we know where the data is going. We have all those structures in place. Certainly that is a big concern. We don't want the data to fall into the wrong hands without the user having control over it. So yes, very good question.
Thank you. So I see a few hands up, so I'll let Martin go first, then Axel and Jim.
Great, thanks. Really interesting. I had 2 questions. One is almost just a piece of history, and that is, one of the founding biomedical engineers, Heinz Wolf, set up a community in London. So he set up a whole part of London that he equipped with equipment like this in Greenwich, and this was an urban trial, if you like, of the concept of using smart home technologies. And I think he rapidly discovered that in deployment, there are a lot of complexities around issues like, well, false positives, how do you communicate with clinicians, how do clinicians manage the volume of information that is coming in and work out how to act upon it, how do you reimburse them for their time. And so there are a lot of operational issues that that are centered around these technologies. And so I wondered what the thinking is in terms of operationalizing rather than just technology development, which actually from what I can see is the simple part of this. The deployment part of it is extremely challenging, and wondered what processes are putting in place to enable us to do that. I guess that would do it for now, and then maybe if there's time, there's another question.
Yeah, no, that is a really great question, and it's something having a clinical background, that's always a big question for me, because false positives they're very time consuming potentially. I don't have a great answer aside from trying to develop systems and machine learning algorithms that can minimize the kinds of false positives that we would expect if we just use regular algorithms. But it really depends on what the data is going to look like and if those differentiations can actually happen. So I expect that AI and machine learning would be a big part of that, because we really need to, the goal of all this is hopefully to offload the effort and the time spent on clinicians, and to put it somewhere else, whether it's with technology or even with the user in managing their own wellness. That sense of autonomy, that they know what's going on with their health, is another important piece that we would want to explore. But really, really, really good question. Yeah.
Thank you, Martin. Can we go to Axel, please?
Thank you, Andrew, for a really nice and comprehensive presentation. I've had over the last year an opportunity to look at the subject area as well, and I was glad to see that quite a lot of things that you said coincide with my observations and conclusions. But I wanted to bring out two issues, and there are more. But the first issue I want to bring out is, looking at the literature, there seems to be an enormous duplication of effort around the world doing what you are doing, or what we are doing here. If I look what's happening in Denmark and the Netherlands and in Japan, it's very, very similar to what we are doing. So my question is, isn't there an opportunity for an international effort, maybe through WHO, to do something in a more focused, cost-efficient way? Canada could look at one type of device, the Netherlands had another one, etc. So how it's parceled up remains to be seen. But that's my first question. Is there room for international collaboration that is coordinated and not just coming to meetings where one exchanges information? The second point I wanted to is more by way of a question, and is you speak about the aging person and the clinician, but you don't really speak very much about the at-home caregiver. These are the other family members or the visiting nurse or practitioner who comes on occasion. And they have different capabilities and they have different needs from what the patients have, who are suffering from frailty and maybe other problems, and the clinicians, assuming the clinicians are even accessible. So my question to you is really, what have you been thinking about the at-home or in-home caregiver, and what one should think about them? And I've got some thoughts as to what one should do there, but the question is really for you.
Great, yeah, really good questions as well. In terms of international coordination, yeah, I've certainly seen, like, we did a broad search of different, I guess, healthcare platforms that are happening in Japan and in Europe. It seems like Europe is driving a lot of the aging in place research. I think the obstacle tends to be the ability to, kind of what you mentioned, the ability to coordinate and actually have action items that come out of it. Certainly there would be some efficiencies that could be gained, but already I think we have to build out some expertise locally, understanding our patient population before we expand too far, because I think there are already needs in Edmonton that need to be served, and we have to understand those. And once we have a little bit of experience with telemonitoring, we can bring those experiences to the table, to the international table. I mean, for the PATH platform, we're bringing it to the national table. Right? There's another site that we're hoping to open out west as well. And so we really want to have this network of different centers across Canada that can come together and do this research. And from there, maybe we can step it up and move it into the international space. So yeah, it's a point very well taken. In terms of the caregivers, that's certainly something that we've been thinking a lot about. I met with Sharon Anderson last week. She was interviewed for an article in the CBC about aging in place, which is really great to see on the CBC. But the idea of navigation, navigating the healthcare system, understanding what resources are needed and all the assistive technologies that are needed in order to help someone with help a caregiver take care of someone who might have a stroke. I think that is an important piece that after that conversation that I hadn't thought of, but that's something that we definitely want to consider. And so having some sort of dashboard or that connectivity with the caregiver is definitely very, very much on our minds. We're talking to Caregivers Alberta to try to get more perspectives on usability and acceptability as well. And in our focus groups, one of the groups we're looking at is definitely caregivers. So again, point very well taken. We're very early, and so we're learning more and more every day about what people's needs are. So yeah, thank you so much.
Thank you.
Thank you. Let's go to Jim Russell, please.
Hi, very nice presentation, Andrew. Really well delivered, and I'm very pleased to hear your focus on the needs of the individual client and the families. But it seems to me if you want to move the platform out of the research lab into the community and have it used, one of the big groups you need to discuss with is industry, right? They all have their proprietary interests. They're not necessarily interested in sharing data. They want to make it kind of their own property they can make a bit of money from. And so that brings up the question of regulations and standards. And it sort of links into Axel's question too, thinking nationally, internationally about moving to some kind of standards that all industries, all people working in this space can adhere to. Your comments on that?
Yeah, that's a really good point, and also something that I hadn't really thought about. I mean, I just recently taken a course on regulatory and quality, and seeing how many standards there are for different aspects of biomedical engineering is fascinating. But yeah, that's something I should definitely look into in terms of the standards that are being used right now in not just data transmission and data collection, but having the whole system put together to collect this data. So yeah, definitely another angle to consider in this project.
Well, there's only so much time in a day there, Andrew. You might find some partners that you and Mike can pull into the system.
Yeah, definitely.
Thank you. I'd like to read a question. Are the newest smart homes equipped with video monitoring? If so, video data can convert to full kinematic models, so you can get really fine-grained details about motor performance. Andrew, maybe you could comment around the use and the perils of video.
Yeah, so video monitoring usually is kind of, it's more of an optional thing in that like people don't build video capabilities into their home usually. They're buying like an external device like the Nest Cam or something like that. The two most invasive methods, at least so far from what we've seen in home monitoring, is video and audio. And it's because there's like what I like to call semantic information, where you can actually tell what the patient or what the resident or whoever's in the home, what they're doing and what they're thinking potentially. And so there's reluctance in using video data. And that's where the having infrastructure in the home becomes important, because if for a lot of people, if you can filter out the face or filter out certain aspects of what's happening on screen, if you can do that in a way that still allows you to get that kinematic data from movement, then it becomes a lot more acceptable. But you can't just do that with any camera. You need to have the processing power in the home in order to do that. So certainly infrastructure is something that would need to be added in order to use video in the home.
Thank you. Vahid, you have your hand up. Please go ahead.
Hello, sorry, it took a while to open the mic. So Andrew, thank you so much for your presentation. I have one question for you. You know, this kind of remote monitoring are very fascinating, but they need a huge computational power, particularly if we use a lot of sensors, because I think that we can't just rely on one or two sensors to look at the whole things that you bring up. So how you are going to tackle this very important problem? Thank you.
Yeah, thanks so much. This is one of the main reasons why we're partnering with Smart One, because they are building condos that have servers that have this computational power built into their condos. They recognize that this idea of edge computing, like you can't stream all this data into a centralized cloud server. There's just way too much data in order to do that. I've crashed the Path platform in its early days a few times because I downloaded more than 2 hours of physiologic data before. And so this idea of edge computing, having computing power in the condo in order to do that processing, that is what Smart One is planning to do, and why we want to partner with them, because they can build out that infrastructure in their own condos, and then we can do some tests and demonstrate this is actually what you need in order to have a smart home. So yeah, totally agree. You need something in the home to provide that power.
So just then, if we have something in the home, then how you want to make sure that nobody actually infiltrate there and don't hack them?
Yeah, the question of data security, right? Yeah, that's not my field, unfortunately. But yeah, that's definitely something that is really important. There's lots of papers that talk about different data security protocols and protecting the data locally, and whether or not you delete the data on an ongoing basis, and how much you're going to send out to the cloud. That's a whole field of research, but it's really important to consider. Yeah.
Yeah, there are also implications in using consumer devices where you don't have the option of local storage, and it has to go through the company's resources. Where, like they say, if you're not sure how the company's making money, you are the product. I want to go to a comment and then a point from Martin again around how there's a bias that seniors are not sufficiently technology literate to use these technologies effectively, despite the fact that Martin has been part of work that where there was data that showed that uptake is actually strongest amongst seniors who voluntarily adopt them. So the question is, how do we change this damaging cognitive bias in our community of researchers that are slowing down the advancement of these concepts? So Andrew, if you could touch on that fairly briefly. You've got a couple more people that we want to get to before we finish up. Thanks. So how do we change that kind of bias about the ability to collect data effectively with these people?
Yeah, that's definitely something that we found as well. I mean, we've talked to the Brenda Stratford in Calgary, and so they're a nonprofit that runs long-term care and assisted living, and they love technology in all their interviews and focus groups. They love it, they adopt it. And so like, I know where the bias is coming from, but it is going to be a challenge to oppose it. My main thought is that the only way to oppose these biases is to demonstrate it, is to prove it through the science, through these studies, that there is actually great uptake as long as it's designed in a way that is actually beneficial to the user. So yeah, I'm definitely in agreement that this bias needs to change. Yeah. So in brief, I guess that's my thought. Do more research in this field and show that older adults can use these technologies. Yeah.
I guess that's just one more example of how our biases can get in the way of evidence-based decision making. So thanks for that, Martin, and thanks for the reply, Andrew. Nancy Martlet had a request in the chat. Andrew, can you talk about the differences between Internet of Things and smart house options?
Yeah, so the Internet of Things usually refers to how every device could be connected to the internet. So that could be your fridge, your phone, your toaster, all the different devices, how you can generate information from these and put it into a centralized cloud in order to figure out what's going on in the home. So it definitely has a relationship with smart houses. The smart home specifically is kind of the definition that I talked about earlier, which is you're able to sense and then you're able to actuate things in the home. And so a big part of being able to sense and then actuate is the Internet of Things, because you need to connect the sensors to the actuators in some way. Now, the question is, do you connect it to the actual cloud, or do you connect it more locally? Those are like infrastructure questions that would need to be answered, whether you use a gateway or something like that. But yeah, they're definitely related to each other. But one is more referring just to the connectivity, and one is more referring to what's happening in the home, I would say.
Thank you. Douglas, you have your hand up. Please go ahead.
Thank you. Hi, Andrew. I was just wondering about the sustainability model in the long term. So once this gets rolled out, sort of who pays for it, and is there any third-party reimbursement? Because supposedly insurance companies would benefit, a healthcare system would benefit, the individuals would benefit. So lots of people potentially could benefit from this, but who pays for it?
Yeah, the $1 million question, right? Who's going to pay for these technologies? I mean, I think based on the data that we have about aging in place, in how it can reduce the cost of building all these new long-term care centers and assisted living, there's a huge benefit if the government helps to pay for it. But I certainly don't think that the government should be alone in that. And so, again, I don't know exactly where all the funding can come from in order to operationalize this on the law in a larger scale. From Smart One's perspective, the value added in having a smart home is already enough to sell smart condos to people who actually want to live in them. Now, I definitely recognize that it's only going to be people who are a bit more wealthy that are able to afford those technologies, and so there has to be something. There has to be something else that can fill that gap to prevent those inequality gaps that might happen if only certain people can afford smart technologies, whereas other people can't. But yeah, in short, I guess I don't know exactly where the funding would come from, but we know that there would be cost savings if we pursued this model. Yeah.
Thank you. Bernal, please go ahead.
I just had a question about the costs, as you were saying. Could it be possible that the one path to solve that would be to interact with, other stakeholders, like the very design of new architecture, construction companies, to relate to them and to say this is what we envision for long-term construction, what I would call sustainable, but sustainable from the point of view of how would the individual age within a certain building, and how what you're proposing has to, relate to the way constructions are made, right? Like if you're talking about using infrastructure that is basically deployed in that building, that means that a large portion of the cost is going to come from the infrastructure itself, and the construction itself affects the cost, the final budget. Is there anything you looked into that, or is that something you haven't seen? Yeah, thanks.
Yeah, I had the opportunity last year to attend a conference about building homes for aging in place. I would say about half of the focus was on the basic infrastructure itself. So making sure that the spaces are large enough for wheelchairs, or making sure that there's not a lot of bumps so that there's not as many tripping hazards. But the other half is definitely on technology. So most of the focus is still on assistive technologies, but certainly there were some conversations about home monitoring and integrating that into the home. I mean, the relative cost of the technology that we're talking about versus the cost of a home is relatively small. So that would be definitely a place that we could look. And there are organizations that are focused on building houses for aging in place. And so, yeah, definitely that's a great idea. Thank you for that.
Thank you. There were a few points that were posted in the chat. I won't read them out, but they're very worthwhile additional comments that are worth looking at. Does anyone else have any more questions for Andrew before we wrap up? So we've only got a minute or two left. Hearing none, Andrew, I think you've given us a lot to consider. I've made a few notes myself for us to take back to our project team to consider more thoroughly. But now I'd just like to thank you once again for presenting the project overview to the Smart Network, and it's a pleasure working with you, and thank you for doing this today.